From the living room to the Senate floor, from first responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
All right, guys. Well, thank you for joining me in what I like to call the most fun hour of the week. We have a very amazing fireside chat for you this week with Tom Gruber that will be moderated by our friend of the jam, Dr. John Draper, on the ethical frontier of AI. If you joined us for the backstage pass, we've already started sharing some information with each other on AI and our AI usage, but I'm very much looking forward to this conversation today. Before we go there, we're going to circle back to that question, right? We've got ChatGPT, Copilot, Gemini, Claude, Perplexity. I'm going to check that one out. Which AI tool do you use most frequently? Which one has the seal of approval from the AI and tech folks in your household or workplace? Make sure you let us know in the chat. And while we're doing that, make sure you also check out crisisjam.com. It is our new website. For those of you who remember the old Crisis Talk website, that's converted to crisisjam.com, and everything you need is there. You see in the corner, you've got the Jam Shop. As you scroll down, you can register to watch us on Zoom. You can also watch us on YouTube. That's the live stream. Get the newsletter so that you're staying in the know. And then, of course, you can see what happened last week. Unfortunately, missed it. It was a really great debate with Paul Galdis and Dr. Joe Parks. And again, that is available on YouTube. You can watch it right there, embedded on the website entirely, or you can go to our YouTube and you can scroll through all of the previous episodes. I believe every episode from episode 35 up until today will be there. So make sure you like and subscribe so you don't miss any episodes. Okay, so we're heading into our breaking crisis news. I'm going to ask Kristen from NRI to come and share a little bit for
Thank you
us.
so much,
Kristen,
Laura,
the
and
floor is
thank you
yours.
all for having me on the Jam. Good morning or afternoon, depending on where you are. Thank you so much for having me. I do have a couple announcements or breaking news for the session. NRI is working closely with NashBid and JBS International on the Samhsa state TA contract. And as part of this initiative, we're coordinating a series of crisis-focused peer-to-peer learning sessions. I'm excited to announce that our next session is this coming Monday, February 23rd, from 3 o'clock to 4:30 Eastern. We're thrilled to have Wendy Morris from NashBid facilitate this session, and representatives from Georgia, Louisiana, and Maryland will be sharing about the great work that they're doing related to crisis services for individuals with co-occurring mental health and intellectual and developmental disabilities. They'll be talking about how they're training their workforce and the resources that they make available to this population. We hope that you can join us, and I'll go ahead and stick the registration link in the chat after I'm done today. Also, NRI has just started sending out its state mental health agency profiles components for fiscal year 25 about SMHA public mental health service delivery. The crisis component was sent earlier than the rest, collecting information about all the crisis services and the implementation at the state level that you all are doing. We sent it out early so we can collect data hopefully earlier, as we're using these data for a national report on the status of crisis services. The remaining components went out last week, and those are focused on housing, financing, mental health services, organization and policy of the State Behavioral Health Agency, as well as workforce. We know that's a topic always in need of addressing. If you have any questions about these components, please don't hesitate to reach out to me or our profile's email address, which I'll also stick in the chat. And just to plug, in alignment with the theme of today's Crisis Jam, we do have some questions focused on the use of AI at the state level, the policies that you have related to that to make sure it's being used appropriately and effectively. And also hot off the presses, and so you can see how we use the profiles data. We've just posted 3 new profiles reports. based on fiscal year 24 data focused on financing mental health services, financing behavioral health crisis services, as well as the SMHA's roles in implementing the National Suicide Prevention Guidelines. All of our public reports are available online, and I'll again put that link in the chat. And if you're a state and you need access to the secure site with all of the profiles data, please send us an email and we can see about getting you a login for that. And with that, I'll hand it back to you, Laura. Thank you so much.
Thank you, Kristen. So much great learning happening. So very excited for that. If you can check it out, so much great stuff always coming out of NRI. So also to put on your radar, there's a national survey for mobile crisis co-responders and alternative response programs. So we have a QR code here. I think we're also going to post a link in the chat. But this is, we heard this last week for those who joined us with Leah Pope and Dr. Amy Watson and Michael from Columbia. Trying to get a national survey to see where are all the mobile crisis, co-responders, alternative response programs across the states. You can see that there. If we know folks who are in North Dakota, looks like we're waiting on some responses there. This is going to really help us ensure that we know the state of the crisis continuum across the country. So yes, Michael Compton, thank you, Jessica. Appreciate that. So if you can complete this survey, if you fall into those groups of the 4 folks who should take this survey, make sure that you do. You have a chance to win a gift card, and you're doing your part to help us, get a good check of the landscape. All right, guys, I hope you're feeling that fire because we are coming up on our hot seat Q&A. Of course, anyone who participates in the Q&A will get a code for the crisisjam.shop where you can get electronics. I got a lightning cord, t-shirts, whatever you want, mugs. So if you are interested in being a part of the hot seat, let us know. Put it in the chat or reach out to us. So with that, let's bring our folks for the hot seat up today. And if I can recall correctly, or if you want to come off mute and let me know who's in the hot seat, we can get this question started. Okay, I think Kelly, I knew it was you.
Oh, did you unmute me? Okay, cool. I was like, well, I can't come off mute. Okay,
Yeah.
perfect. Thank you.
Yes, and
I'm so worried.
No, you're going to do great. And we've got in the hot seat with you Rebecca Boner, who's also a student who studies under Dr. John Touros. Okay, yes.
Hi.
Thank you, Kelly and Rebecca. Hi. Thank you for being a part of our hot seat.
Thanks for inviting me.
Yes. Okay, so we are going to ask you a question. You'll see here, we've got 2 handsome fellas with some dueling daffodils. One of those individuals is Dr. John Draper, and the other one is Tom Gruber. They have been friends for a long, long time, going way back when. And so as, they're having conversations as friends do, Tom shared with John that blank was coming, and it would change the way that people would connect everywhere. What do we think that blank is? Feel free to talk it out. If you're in the audience and you want to drop in some feedback or help, go ahead and do that. Make sure you fill out that poll in front of you. I see the gears turning, Kelly. What are you thinking?
I'm gonna go. I'm trying to be like, how old do I think everyone is? I'll go with C.
See the smartphone. How about you, Rebecca?
I don't know. This is tricky. I'm leaning towards electronic mail.
Electronic mail. And just to recap, we've got AI therapists, social media, a smartphone in your pocket, electronic mail, also known as email. But
I think so. I think I'm gonna go with electronic mail.
All right, we've got, this is close. 30% of the audience thinks it's AI therapist, followed by email, then the smartphone, and then social media. So that's what the audience says. Let's see what the correct answer is. Drum roll, please. All right, it's electronic mail. John, do you want to come up and give us some context to this conversation?
Yeah. Tom and I were talking, as we often do, it's spirited debating about various topics, and he was telling me about this, and I thought, oh my gosh, that sounds great. And he said, yeah, it is really great. It's going to be connecting people everywhere in ways that we could never imagine. And then I thought about it for a minute, and I said, actually, Tom, I'm a little worried about this because for people who are socially awkward or socially anxious, I'm afraid they're going to spend more time emailing each other than actually talking face to face. Years later, we revisited this conversation and we agreed that we were kind of both right.
I love that. Yes, I think that's a fair way to split that. We'll have to see who won the dueling daffodils war when we come back to you for our fireside chat. But thank you, Kelly and Rebecca. You guys will both get a code for the Crisis Jam shop, but we also have, I think, one more with you all. So that is going to be our over-under. Let's go there next.
The time has come for this. Nom, nom, nom.
Okay, so Cookie Monster has let us know that the AI in healthcare, right? So there's a recent report from Harvard around the use of AI in healthcare from strategies to implementation. Based on that report, we've got this question, and this question is also going to involve the audience again. So Harvard is estimating that AI will reduce treatment costs 50%, improve health outcomes 40%, and then have a $188 billion market share. So the question today is, what percentage of jammers, that means everyone on the call today, would be comfortable with their healthcare provider using AI tools? So if you are listening, drop in the chat what you think. Kelly or Rebecca, one of you will say, hey, what percentage of the jammers today you think would be comfortable? So maybe half of the folks on the call, a third of the folks, and then the other person will say, I think it's over or I think it's under that number.
All right, Kelly, do you want to make a number or should I make the number? Okay, I'm going to do it, I guess. Okay. I think that if it's of the people on this call, I would have to assume that most of you are probably crisis averse. So I would interpret that maybe like 15% of you all, I think, would maybe be comfortable with their healthcare provider using AI tools. I think it depends. This is I feel like the question is very open-ended, the better conversation of like what this question means, how are they using AI tools? Are they providing you the care, or is it just helping with administrative burden, like outreach to patients or responding to messages? I don't know. I think I would have different answers for the breakdown of what could come from this question.
Those are great researcher questions, but this is the Crisis Jam. We're just having fun. So 15%, what do you think, Kelly? Over or under?
I'm going to say over. I think it's way higher than that.
Yeah, I would tend to agree with you. And I think based on what we're seeing in the chat, folks are saying pretty high. Don says he's comfortable. So I'm going to say it's higher. So I'm going to give Kelly this win. Sorry, Rebecca, but you got it on electronic mail, so it's a split 50-50. Awesome. Well, thank you, ladies, so much. Appreciate you coming on the jam and look forward to hearing from you later.
For sure. Thanks for having me.
Of course. AI is endorsing AI. Oh, no. All right. Well, I think that brings us now to our lead story. Okay, and for this fireside chat, I'm going to turn it over to Dr. John Draper.
Thank you, Laura. Tom Gruber is a visionary entrepreneur and AI expert, and Tom is renowned for his role as CTO and co-founder of Siri. He's it's the groundbreaking voice recognition technology that we all know about that was acquired by Apple in 2010, and he's also a product designer and advisor. And Tom has a passion for leveraging artificial intelligence to enhance human potential. And as he blends the deep technical expertise with a commitment to ethical innovation. As a highly sought after speaker internationally, everybody loves to hear Tom talk about what he envisions the future as basically a place where technology and humanity can thrive together. And Tom is lesser known as my old buddy, whom I met as a rival debater at another Houston high school many, many moons ago. So, Tom, you were telling me the other day, listen, welcome. And from Hawaii, no less. That's probably, is that a real background? That is actually,
that's my view. Yeah.
Beautiful. All right. Well, you were telling me the other day, probably from that balcony, what is happening with AI now over the coming year or two is a lot of people are saying it's very similar to the arrival of electricity at the turn of the century, the 20th century. But you said, no, it's actually more like the discovery of fire. Did you think when you were creating Siri that you were rubbing two sticks together that would one day become a cultural wildfire? Is it arriving in the way that you imagined it to?
Well, yeah, no, I mean, it didn't arrive the way I imagined. Everything was going kind of smoothly and slowly back then. And so we were kind of happy to put our stick in the ground for history and bring in the conversational interface. But we certainly didn't bring in what happened in 2022 when the chatbots arrived on the scene that could actually understand English completely and have a conversation with you. That happened exponentially, as they say. So, things were kind of going up, and then all of a sudden, boom, they exploded. And the explosions are just beginning to unfold. It's still moving exponentially, meaning that things are changing at doubling rates of every few months. So it is, you do feel the fire. I mean, I like another metaphor I like to use is the tsunami. We're kind of on a big wave. Right. And it's either like going to swamp us or we're going to catch the wave. But we better get our surfboards out because it's happening fast.
Well, even before 2022, Tom, you were talking about the ethical uses of AI. And boy, do we really need that conversation now. So what are your guiding principles, your advice to people and to companies who are seeking to develop or apply this powerful technology?
Yeah, thanks, John. That's an important one. I mean, people ask about how do we make good choices in this, and the answer isn't just do the right thing. There are some principles, and one is that there's been sort of two kinds of AI projects throughout the history of AI. And one is that the pursuit of making intelligent machines kind of for their own sake. So in that path, you see things like celebrating that it could beat Kasparov at chess, or beat the Go, Lee Sedol, and so on. As it starts to beat humans at things and go, yay, AI is getting good. And then this is good work, but it's a different approach. The current version of that is we're going to automate all white collar work. And so the other path, which I call humanistic AI, is essentially an ethical choice that you choose to do AI projects that are aligned with human needs. That is, that the purpose of the project is to do something humans already want to do and do it better, usually by augmenting human intelligence or capability or possibly collaborating with them. And so if you look at the world through that lens, you see that you can, where you start your project or the way you enter into integrating AI in your work will have a big impact on the ethical consequences, the moral consequences that you have to face later. And so, for instance, if you start out saying, hey, I want to solve human needs, well, one of the first things that comes to mind is what are human needs worth solving?
Right. Well, it's a really important advice. I mean, rather than worrying about what AI is going to do to hurt us, now is the time, as you're saying, for leaders and visionaries to use AI as a tool to actively solve great problems that face us.
Exactly. Yeah. In fact, I would use the word moral imperative. We're at a point where So look, we know a few things about AI. It's moving incredibly fast, faster than any technology we've ever seen before. Moving in the sense of improving and changing. We also know that it's omni-purpose. That's why it's being compared to fire and electricity. You can do everything with it. Anything that requires cognition as a service, you can do with this. But it's also, at the same time, we know what we don't know. We do not know the future. The future is extremely hard to predict. We don't know which applications are going to work. We don't know the unintended consequences of those applications and so on. So at this point, given those things that we do know, that essentially it's a morally almost like imperative, it's important that we only choose to do work that is taking the gambles on achieving really important, goals of humanity. And one of them actually is the one when people say, well, what do you mean? Like, what are your most important goals? The first one I usually list is mental health care. It is it's the lowest hanging fruit of problems that are affecting all of humanity. World Health Organization, I quote, says 1 billion people are suffering from clinically severe, you guys know this, but I mean, it's like amazing. And yet, if you think about it, despite your work, the great work of this group, there's never, ever, ever going to be enough humans to service them with one-on-one conversational care. And so it's a place where AI really can and ought to be able to be used.
And what you're saying, essentially, this is a moral imperative, actually, for us in the mental health world to be actively, intentionally engaging as experts with AI developers to solve some of these great problems that we all know exist in mental health. And you're saying one is that we just don't have enough access to therapists, psychiatrists, psychologists. We need to use chatbots in some ways. But it sounds like what we really need to do is we need to engage, not with fear, but with intent and excitement, enthusiasm, and capability with developers. Is that right?
Well, absolutely, John. I think you're getting right to the core of it. Like, let's go back a few years to the previous massive use of AI on humanity, which was social media. Social media, as most of you know, uses AI to optimize the addiction of its users. It's an unfair advantage. It has all the data of billions of people, and it uses it against their best interest to addict them. Now, this use of the technology is an you could say unintended consequence, but it was an unconscious use of AI. And it was never designed to improve mental health care or mental health or even thriving of humanity. It was only made to improve the bottom line of social media companies. So with that goal being profitability or addiction, growth of user base, that had the consequence we see. So now what the difference is, as now people, in fact, are seeing AI going, well, we don't want bad stuff coming from AI, and we should tell the AI companies that, like, OpenAI and Anthropic and Google and so on, to do the right thing. And what I'm saying is they're not going to do your job. And just like social media, well, social media is a special case. They knew better, but they didn't do it. They did the wrong thing. But in this case, they're not going to do what your job would be, was to like make an actual mental health care experience. They're going to give a generic thing, and they're not going to be like the power company. Here's the electrical feed. You need to build the machine that runs on electricity. You need to build the application. And I'm saying it's easy for me to say. It's hard to do this, very hard. But if we don't do anything, we've already seen, like the Common Sense Media report came out very clear, kids and adults will go to generic chatbots and act as if they're friends and therapists.
Yeah, just recently, Tom Insel, who you may know, was recently a guest on this show, and he reminded us that we need our subject matter experts to work with all the AI developers to build these purpose-designed applications. And he was specifically saying that using ChatGPT or generalized chatbots for something like psychotherapy is like using a Swiss Army knife for surgery. So we really need to say, this AI isn't bad. We can make it good, and we can do some special things with it. Are there some specific things that you're aware of in the mental health space that you think are really exciting prospects for us?
Yeah, the therapists that I've talked to, clinicians like who I've asked the question to about, what do you think about using AI in your field and so on, the practicing folks, they're saying, look, things like cognitive behavior therapy algorithmic kind of therapy you can do in your sleep if you're an AI. That should be easy. It is being done all over the place. IFS, integrated family systems or whatever it stands for. Also kind of a kind of a talk therapy that has a kind of algorithmic feel to it. That also works pretty well in the modality of conversation with an AI. Now, it doesn't mean you just say, "Hey, go do IFS." You have to, work on how do you build an AI that actually listens and remembers. Those are unsolved problems right now. How it remembers about you is kind of a hard problem. But those are some low-hanging fruit for therapy. Now, and the kinds of conditions I'm hearing people say, yeah, we think it could be anxiety, depression kinds of things, PTSD in some sense. Probably not schizophrenia and psychotic breaks and things like that yet. Although the diagnosis of those things has been shown, AI has been extremely good at predicting psychotic breaks, better than humans.
See that.
From very subtle signals. Yeah.
Yeah.
And other things but then there's other things that are sort of adjacent to, straight out therapy. If you think about, you're now in a relationship with another agent. Yeah, it's not human. It does talk a good game, and it can pretend to listen pretty well. So what else can you do with that? Well, first of all, the thing can help you remember. And so memory is sort of the foundation of cognitive function, right? And so if we can sort of raise the level of everyone's memory with augmentation, then you can not only help, folks on the sort of the able-bodied end, like remember the name of that, someone's wife or, whatever it was when was the last time you saw them? So social grace kind of, but all the way down to the, grandma's losing it and we don't want to put her in a home, but she's having trouble remember things. Can we help her stay at home longer? Mm-hmm. Remember to take her medicines, remember how to reach her family and so on. Those are real low-hanging fruit applications, and there's folks building those applications. I'm advising some of them. There's happening today. Again, this is not going to be built by somebody in Silicon Valley working on machine learning models. It's going to be built by professional subject matter experts.
Well, regarding these mental health applications, Tom, that can help us solve human problems, I got to ask you this. This is reminiscent of a previous conversation we've had. That we have a growing problem with loneliness and human connection. And our recent Surgeon General Vivek Murthy called this a loneliness epidemic and put out a huge report on what we should do about this. And Mark Zuckerberg, he suggested that AI companions can solve the problem. Meanwhile, Princess of Wales, Kate Middleton, thinks that machines and screen time are actually what's causing the problem. So as we're likely to become more reliant on AI, what do you think the role of AI could be in addressing the problem of human connection?
Yeah, that's a good question. I mean, there's the guy who wrote the book Bowling Alone. He's got a new one out that really addresses this issue pretty well. How can technology how can structural things in the society, including technology, help facilitate societies that have less loneliness? But I actually, in principle, the AI conversational partner can be a collaborator in lots of ways. And for someone who's like a shut-in, who's leading, they maybe need some way of getting a sort of a bridge to the outside world. And it's not necessarily a replacement for having a friend, but someone who can remind them that their extended family is there. Would you like me to put your daughter on the phone? How about that? Or how you feeling? Da, da, da. There's use cases there that are quite appropriate. Even having a conversation with someone who's living at home, who's elderly, at the borderline of needing institutional care. This is really a really crisis. This is a real buffer zone here where we can have a lot of impact. And in those cases, having continual conversations with them will improve medical compliance, that is taking their pills and so on, but also give the signal to the machine to help detect things like you can detect from the tone of voice, not the tone and character of voice, a stroke within 30 seconds of a conversation. AIs can now. They can also take blood pressure measurements by looking at your face and the heart rate. And so there's a lot of benefit from just having what used to be human contact, but now it'll be machine contact. But it doesn't replace, of course, the fact that when that contact is made, it's like, hey, time to go to the doctor. Call your doctor or call your daughter, or you just, get out and walk around. it has that effect.
I think I shared with you, Tom, this statement from a number of experts. It was spearheaded by Ursula Whiteside, who's going to be in the roundtable in just a little bit, that we sent to a number of leaders in AI and I believe the federal government as well. And one of those recommendations was basically, for whenever there is a need for humans, don't substitute for that. Say, hey, let me help you connect with a human wherever that makes sense. I am not a human. I can't solve that problem. And it reminds me, what do you think should be the role of government, academia, and civil society in all of this?
Yeah, well, that idea the basic idea that there's certain bright lines of transparency that ought to be guaranteed, like labeling rules, like we do with food in the U.S. You can see whether it's poisoning you with sugar or not, or alcohol. You can see it in a label, what's in there. Okay, and we forget that that was a kind of a government thing that we did. It's a regulation, but it has huge impact on the ability for people to self-manage their healthcare and self-improve, right? Well, you want the same thing for our mental health and AI. If something is pretending to be a person who exists, who's faking a person, that should be against the law. That's against the law in many fields. If you're a policeman, that's against the law to impersonate a policeman and so on. Yet apparently we think it's fine to do that, in political games. Now, that's also, you can generalize that and say, might want to be against the law to impersonate any person without saying you're a person, by saying you're a person when you're not. So fraudulently representing yourself as a human therapist or a human anything, if you're an AI, will confuse people and obviously break down the trust. And so there's a small number of these are very, very small asks for government, right? Just set the rules, a little labeling, a little transparency. This is not a free speech hit. This is just like, this is an AI talking, so you know what you get, right? Right. I think you can go beyond that, where you can start to say, well, what is the responsibility of a provider of AI? And there's a whole body of law called fiduciary responsibility law, which applies to doctors and accountants and so on. It said that you can be sued if you put your own personal best interest above that of the client. I don't know if it applies to psychology as well, but it's an important body of law. The reason it's there is to create a trust relationship between the person and the provider of the service. And that wasn't by accident either. That happened because we had government there to help us set those guidelines.
Tom, I'm so thankful for joining us today and really appreciate, I know it's very early there in Hawaii, and thank you for giving us a little picture of Hawaii, but most importantly, your incredible knowledge. We could talk all day, and maybe we will some other time, but thanks for joining us. And Laura, I'm going to switch it back to you.
Pleasure.
Thank you so much, John, and thank you, Tom. What a great discussion. I could listen to you both all day, but I'm going to bring in our roundtable so we can get some thoughts on that fireside chat. So for today's roundtable, we are very lucky to have coming back from the trivia hot seat, we have Kelly Davis, who's the Vice President of Peer and Youth Advocacy at Mental Health America. And joining us is Dr. Ursula Whiteside, the CEO of Now Matters Now. Kelly, I'll go to you first. What are your thoughts and reflections here?
I think that I agree, and I think that the ethics piece and making sure that people know what they are engaging with is important. I would say that I think one of the most important things that is not offered to people is like harm reduction, so they don't know how any of this works. And I think that's one of the most important things, right? So if you know that the longer you use these models, they get kind of weird, you can make a different decision, right? If you know the limitations of the models, that's also important. One of the things that I just wrote a paper, I think there's a couple things that I think are most important too. That common sense media, I think one of the biggest problems, and what I found in this paper that I just wrote, is the core competencies of peer support almost map directly onto why people say they use AI. And if we don't it's wrong to not build out the other thing. If we know that people are coming to this for reflection, for relation, like for if they're ashamed to talk to other people, then we can't just say don't do this. We should give people alternatives and kind of the gap in between. So I think that is one of the things that I feel like gets left out of a lot of the conversations, is even if we figure out how to support people and say, this is a tool, this is how it works, this is what mental health care is, this is how it works, the huge gap in between is what gets left out of those conversations. So I think the ethics is important, but also that we have some answers and an existing infrastructure to build the like in between where people can better choose based on their needs, what to engage with.
Kelly, I liked how you were talking about the reasons people go to chatbots is this, there's some reasons that they go to peer support or they desire peer support, but we also know that like the accessibility of peer support, this is still an emerging field. It's not as easy to access as we'd like. It's not as easy to get paid for as we'd like. A lot of people who are joining this meeting understand that more than anybody else. I think the speaking to the transparency is so important. Just like I got a couple calls from my mortgage person, like over the last couple weeks, they like call me back. Finally, I answered when they called, and about like 20 seconds into the conversation, I started thinking, is this like an AI chatbot? And they wanted me to schedule with the person that I had worked with in the past. And finally, I just said, are you an AI? And they said, yes, I'm an AI, like, let me know how I can schedule you. And it was this weird, twisted feeling of like, wow, I've been worried about this person I haven't been calling back, who one is not a real person. Two, this person, the sound of their voice, very empathic, very socially skilled, but it was some of the like very sort of like pauses that cued me in, or maybe it's like at the end of a breath, or maybe it was the missingness of the breath that cued me in to that, and it did leave me with this weird feeling. And I've yet to reach out to the broker and just say that, hey, that was kind of weird. But going back to what we were talking about, Tom and John, about there are simple things that we can do to label like this is an AI, that's what's happening right now, and we should be informed and we should know about that at the bare minimum. And that, these organizations who are doing this work are some of the most brilliant people in the entire world, and they've got a lot of things to do, and there's something new at all moments. And so it really does seem like smart policy is what they need in some ways to help focus that energy and that attention in the areas that we need them to. That like we really need to do this very, very well in order for us to take advantage of this enormous tool. So adding on to that, Kelly, like in terms of peer support and the alternatives, how do we think that AI could potentially support that? They're generating all these potential users. They're identifying all these people who could use the help, and they're helping get them to the 988 and crisis lines and as well. But what else might they do? And I have some ideas about that too, but I was curious what you might think.
I think two things. One, part of the other thing, and I used a famous AI that says it's a therapist when it first came out. And one of the issues that I have focused on is harmful refusal. So if people don't understand and they get like activated, or they don't understand that this AI is actually programmed to push back, I think that's a huge problem. And the research is starting to show that we need better kind of frameworks. I think the other piece that I have also worked on is this idea, like I would call it like 988 or nothing, where it's like, if you are using this in extended period of times for a specific reason, even if you go to 988, you come back. because it doesn't meet the same need. So I do think we have a lot of things from peer support, like advanced directives, like doing kind of starting out by being, what are your grounding tools? Who can reach out to you? Who can you reach out to? Because again, I think that we just kind of abandon people about what the in-between could be, especially if they've never been in an environment where someone says, right, like a RAP plan, right? It's like, what are your tools and how can we support you, instead of just kind of giving a hard refusal and telling you to go somewhere else.
Yeah. And I'll just add too that we know that sitting and talking to somebody who's suicidal is a skill, and a lot of people don't have that naturally. I think actually they probably have it naturally and then they lose it over time with just learning to be afraid. And the machines don't have that built-in fear. And so I think that AI could potentially be teaching humans how to better sit with somebody who's struggling, because I think as a whole community, we all need to get better at that. And there's so much room for growth without panicking, without, trying to involve emergency services, providing hope, but without doing that in a Pollyannish way, like being present with that person. I think these are things that AI could help us learn and help us be better able to be with people who are in their darkest moments. Thanks for giving us an opportunity to share. And so glad. Yes,
so
please.
I could talk about this endlessly. Sorry. I think that the one piece there too that I think is really important is we kind of know a lot of the problems that have been in the field, right? It's technically different, but the problems reflect a lot of the history of how things like suicide or like intense emotional experiences, people speak about them. So I do think one of the other things that is being used a lot is using AI to train providers. So I also think that that is a big opportunity to engage people with lived experience to help kind of shape this refusal in a way that is not harmful to people. Because I think there was a framework that was introduced. I'll have to look it up and I can drop the paper in, but a framework for what like harmful like harmful refusal works. And if we can have people with lived experience be involved in the like this helps and this harms in the training of clinicians who are often not trained in some of the suicide prevention as well. Sorry, does that add that?
No, listen, guys, this has been such a thrilling roundtable, just as informative for me as the Fireside Chat. So thank you both, and thank you, Tom and John. Let's move the conversation to the chat because I think there's a lot that can still keep going. And I'm going to pose this question that I would love, the roundtable and John and Tom, your feedback on. Do we get to a point where, like a Citizens United for AI, where AI could be considered people like the way corporations are? How do you all feel about disclosures? If we could move that into the chat, because I'd love to keep that going, but I'm being moved along. So I'm going to turn it over to Dr. Richard McKeon to give us a Samhsa update. Richard, you're muted.
Let's try this again. Okay, so glad to be back in the briefing room here on the Jam. A couple of things that I wanted to mention. As most of you may well be aware, the cooperative agreement for the 988 Suicide and Lifeline Administrator is currently on the street. The closing date for that is February 27th. So that's in 9 days. So if you haven't gotten your application in, or you are considering putting in an application, be aware that that time is running out. And there are a number of requirements in terms of applying for all Samhsa grants that can sometimes take, some time to set up as well. So if you're wanting to put in an application, do get yourself started. And also for everyone, keep your eye out for the next 3 988 grant opportunities that will be coming down the pike. The state and territorial 988 grants, the tribal 988 grants, and the crisis center follow-up grants. They will all be following, so please be alert to those as well. We'll certainly share on the jam when they are out. Just going to mention 2 other things. I've been preparing for a talk I will be giving at March 4th on 988 rural communities and suicide prevention at HRSA's Community Rural Opioid Response Grantee Meeting. And as I'm preparing for that, 2 things struck me that I just wanted to emphasize. One, of course, is that we know that suicide rates are higher in rural communities, they're higher in rural states, and in every state, they are higher in the rural parts of that state than in the urbanized and suburban ones. So that's an important piece we'd like you to keep in mind. The other thing is that I was reviewing some research, and Dr. Michael Schoenbaum from NIMH was a co-author on this study. But what they did was they looked at mortality among everyone who presented to an emergency department in the state of California over a period of several years. And what they found was really striking. First of all, it's really rare for this kind of research to exist, that even though in other areas of healthcare, there's outcome data that where mortality statistics are shared, for example, after cardiac surgery, there isn't anything similar in behavioral health. But what they did was looked at after an emergency department presentation. What they found was the base rate in an emergency department for everyone was twice the national rate, consistent with what some of the studies have shown the impact of universal screening in emergency departments, namely that it doubles the identification of suicidal people. But it also found that people who presented to an emergency department with a suicide attempt over the next 12 months were 56 times more likely to die by suicide. And those who presented with suicidal ideation were 14 times more likely to die by suicide. But in addition, what they found was the relationship between suicide and accidental overdose. Those who have been seen for a suicide attempt or suicidal ideation had also higher rates of accidental death as well as death by suicide. And similarly, those who were there for accidental overdose, if that was the reason for the emergency room, they had elevated rates of accidental overdose deaths, but also elevated rates of death by suicide. So again, the importance of rural suicide prevention and crisis care on the one hand, and also the important link with substance use and with accidental overdose. Thank you.
Thanks so much, Dr. McKeon. Again, those things go so close together. So appreciate you. And maybe you can drop that in the chat. I'm going to send it over to Jessica Pollard for the NASHBID update.
Thanks, Laura. And I had my camera off during the fireside, so none of you all could see me vigorously nodding and appreciating those unsurprisingly excellent insights. So I wanted to mention a few related points for NASHBID, along with our colleagues at WICHE and other organizations. We are planning our 2026 National Dialogues on Behavioral Health Conference, and I'm very excited to say the topic this year is digital mental health with a focus on AI. So for those of you who are saying, I wish there was more time for this conversation. I don't want to stop talking about this. It's, really wanting to go into more depth. And if you have participated in a National Dialogues conference before, that's exactly what happens. It's an in-depth, there's some presentations, but really a whole lot of dialogue happening. So very excited that digital mental health and AI will be the topic for 2026. So don't have the exact date 100% ironed out. So just block off early November. Plan to be in New Orleans for that conference. That's my weekly teaser, and we will come back to you with more details as that registration becomes available. So just quickly, we'll mention some of the things that state behavioral health leaders have been thinking about are so in line with what the conversation has been today. I love that framing of aligning AI purposes with human needs as a frame. I think that's exactly the kind of conversations we're having with state leaders. We know we have insufficient workforce capacity. We know we have data that we just don't put to real-time use and drive policy decisions with more robust data analytics the way we could. For me, the big pieces are quality and training, using AI to really enhance those functions. But totally agree, it's not just about, there's AI versus humans. We're really, I think, needing to acknowledge that in some areas, in some places, it's really not digital mental health versus a human. It's digital mental health versus nothing in some areas. And that definitely needs to be addressed. But I think for me, it's really important that we keep using the right comparison points when we're saying, what we're comparing AI and other digital mental health to. And oh gosh, there was another comparison point I wanted to make. I lost my train of thought. That's okay. So some of the things that state behavioral health leaders are thinking about that I'll just quickly mention is, what are some of the liability considerations for states as they think about supporting or not supporting some of these tools, data privacy considerations from a regulatory standpoint. Also, what are the guardrails that we need to be thinking about for preventing improper use of clinician tools? So, for example, I mentioned last week on the Crisis Jam, I use it to review the writing of my documents. I don't use it to generate my notes, but some people do, ambient listening or using AI to generate content. How do we make sure clinicians are actually reviewing that? What are the responsibilities of making sure the tools are used properly? This was the comparison point I wanted to make. So we think the state leaders are interested in crisis and chat or AI. How do we make sure that good guidance is provided by chatbots, by AI? And again, I want to make sure we're thinking about the comparison point. If I go to my postal carrier and say, hey, where do I get good mental health services? I'm not asking the appropriate place. I'm not going to hold the postal service accountable for that knowledge. But where is the line for state leaders to be thinking about when and where it is appropriate to be holding accountability? What's the implied kind of therapeutic description for these things that we want to say, okay, if you're calling yourself this is when you have that responsibility. And I'll give it back to you, Laura. Thank you.
Perfect. Thank you, Jessica. Again, great questions. And I think NASHBID has a convening coming up in the summer. So another place, if we're looking to continue these conversations, that we recommend. With that, I'm going to keep us moving, and I'm going to turn it over to Daniel Heron from Vibrant and Samira Schreiber from NAMI for our state updates.
Great. Thank you, Laura, and hi, everybody. Just want to share a couple of state legislation updates now that 43 states are in active legislative session. Going to start by highlighting Alaska Senate Bill 196. This was introduced last year as a 90-day telecom fee that would have created a 98-cent monthly telecom fee and is estimated to generate between $6 to $8 million per year for the Alaska 90-day crisis system. This bill had a hearing before the Senate Labor and Commerce Committee last Friday. So it's good to see that that bill is still live and moving in FY or in 2026. I also want to flag in Oklahoma, House Bill 4092 would establish a 988 trust fund, a sort of a designated place to store 988 funds. The bill doesn't actually provide 988 funding, but it's sort of that first step that we see a lot of states take as they look towards more sustainable funding for 988 and crisis services at large. That bill had a hearing last week, and also it was passed out of the House Appropriations and Budget Health Subcommittee, and is now pending a full vote before the committee. And with that, I'll pass it to Samhsa for a couple more updates.
Hi, everyone. Just wanted to share a few states are addressing the recent removal of the LGBTQ plus specialized services press 3 option. And California is one of those states. They introduced AB 1450, which would set up a state level LGBTQ plus press 3 option. And then Washington has a bill to increase their 988 fee from 40 cents to 60 to 80 cents. And then it also includes that they can use those funds generated for the specialized services. And then Illinois also introduced similar legislation, HB 5520, which would amend their existing 988 trust fund that they can use the 988 trust fund dollars for the specialized services if the federal government continues to not provide press 3. So just wanted to share those updates. I'll put the links in the chat. Thanks, everyone.
Perfect. Thank you, Daniel and Samhsa. And I guess I would be remiss if I didn't say a happy belated birthday to Daniel. So he just celebrated, I believe it was yesterday. So we won't say the age, but happy birthday, Daniel. That's getting lots of love in the chat. So with that, I'm going to give it over to Kristen to take us home.
Thanks so much, Laura. I figured in the spirit of today's conversation about AI, I should be an avatar to end our show today. Maybe a little different, but it's okay. Felt pretty fitting if you ask me. Huge thank you to Dr. Tom Gruber and Dr. John Draper for a really good fireside chat on the ethical frontier of AI. These conversations are incredibly important because AI, for me even, is really helpful, sometimes a little unsettling, but undeniably a force that is shaping how we think about care, safety, human connection. One of my biggest takeaways is that technology isn't always our solution, but it's how we intentionally and responsibly use and choose to use it. So looking ahead to Crisis Now 4, coming this July, the momentum continues to grow. We're excited to welcome even more state participation, including Rhode Island and Tennessee, with representation now reaching up to 6 countries, if you can believe it. Crisis care and conversations are expanding in meaningful ways across the systems and across borders. Those are some of our summit partners. We are always looking to share with having more sponsors and more folks that are coming. Between these critical debates, fireside chats, lived experience voices, system innovators, this is truly one of those moments where you are going to want to be in the room where it happens. I may start singing if we don't move on, but great timing though, because the agenda should be going live this week. I know I said last week, but there were some refinements that we wanted to put up there. So I anticipate it should be up there this week. Next week, our headliner sponsor, AHP, brings us Building the Behavioral Health Crisis Workforce, a conversation that continues to sit at the center of everything happening in crisis care, because without our workforce, we can't really do the great work we do. 2 weeks from now, we're going to dive into the true cost of behavioral health care with Dr. Margie Balfour and Matt Miller. Like I said last week, not back in the napkin math, but some actual true costs to how do we make this happen. 3 weeks out. Oh, Jessica, I wish there would be a sing-along at the Crisis Summit. I would be the first one up there. 3 weeks out, Kelly Davis joins us to explore youth voices, navigating behavioral health crisis, bringing some lived experience and some of our youth together. And on March 18th, we keep talking about it. We have our debate number 11. We're going to take on whether mobile crisis teams should respond in pairs. We're going to feature Megan Gleason and Dr. Ken Minkoff. We love our debates. They're usually really lively conversations that we can share some insights to both sides of the coin. So thank you so much for being part of the jam. Thank you so much for watching. Be sure to tune in, log on, join the movement, and we will see you next week.